You've made it to video 3 in our series on COVID-19. In our first video, we discussed what COVID-19 is exactly. The second highlighted who is at the highest risk and what symptoms you may experience if infected. So be sure to watch those videos if you haven't, and if you have, thank you for following along. Now let's jump right into this video and discuss some ideas for protecting ourselves during this pandemic. So here it is, the secret to avoiding exposure to the virus. Are you ready? The best way to prevent the illness is to avoid being exposed to the virus in the first place. This is why officials recommend social distancing during an outbreak. In reality, though, we don't live in bubbles, so we are more than likely going to come across viruses. So how do you protect yourself? Number 1, clean your hands often. The number 1 choice of cleaning your hands is to wash your hands with soap and water for at least 20 seconds, especially after being in a public place or after blowing your nose, coughing, or sneezing. The number 2 choice is to use hand sanitizer if soap and water are not readily available. However, you want to make sure that the hand sanitizer contains at least 60% alcohol. Also, in general, avoid touching your eyes, nose, and mouth with unwashed hands. Number 2, to protect yourself, is avoid close contact with people who are sick. If it's spreading in your community, put distance between yourself and other people, regardless of whether they're sick or not. Remember, this is very important for high-risk people. So, how can you protect others? If you're sick, stay home except to get medical care, but call the doctor first before actually going to the office and let them know that you might have COVID-19. Also, avoid public areas and public transportation, but please realize that this does not mean stay indoors necessarily. If you can be outside while still avoiding others, there is some healing power that only the sunlight can do. Also, stay away from others in your home if you are sick and they are not. Stay in a specific room and use a separate bathroom if possible. Also, avoid sharing personal household items such as dishes, cups, utensils, towels, or bedding. And then here's the kicker. Stay at home until instructed to leave. And that's basically until the risk of secondary transmission is thought to be low. For this, you'll need to talk to your healthcare provider. Lastly, wear a face mask if you are sick. If it's not available, do the best you can to cover those coughs and sneezes. But if you are not sick, you do not need to wear a mask unless you're caring for someone who is sick and they're not able to wear a mask. Face masks, if you haven't noticed, are in short supply and should be saved for caregivers and healthcare personnel. Now, to protect others if you are either sick or not sick, so this is everybody. Cover coughs and sneezes with a tissue or the inside of your elbow and immediately wash your hands. Clean and disinfect frequently touch surfaces daily or if the surfaces are dirty. So you want to clean first with a detergent or soap and water, then you disinfect, and that's with household cleaning sprays, diluted household bleach, or 70% alcohol solutions. Now, some extra information for higher risk patients. Remember, this includes older persons and those with underlying health conditions such as heart disease, high blood pressure, diabetes, and lung disease. This information is for you. So these are instructions from the CDC, which include stock up on medications and supplies for several weeks. Yes, this is why everyone is freaking out about toilet paper. The idea behind the recommendation is for high-risk people to avoid these public places like supermarkets during this period when exposure risk may be the highest. Other recommendations include keep space between yourself and others, limit close contact, wash hands often, avoid crowds, cruise travel, and non-essential travel, and if an outbreak is in your community, stay at home as much as possible. We firmly believe that what we consume supports our body. Supplements like probiotics, vitamin C, zinc, vitamin D, and N-acetylcysteine, or NAC for short, could offer a boost to our immune systems during this time. Please reach out to the staff at River City Pharmacy if you have any questions about COVID-19 or immune support. Thank you for watching this video. Don't forget to click subscribe and the bell icon to be notified about our future videos. We have one remaining in our COVID-19 series. We have some information for you breastfeeding moms. Please stay tuned for that video. Bye!